Hi, I am Dr. Shashidhara Gopalakrishna, a senior consultant and medical superintendent at Apollo AyurVAID Bangalore. My area of expertise is Kayachikitsa or general medicine in Ayurveda, and I deal with various cases of general medicine. Today I will be talking about dermatitis, allergic dermatitis in particular, and atopic dermatitis. So as you all know, atopic dermatitis or allergic dermatitis is one of the very commonly found skin disorders, and Ayurveda has a lot to offer in this particular disease. So as you know, these diseases like allergic dermatitis and atopic dermatitis are chronic disorders, and there are only symptomatic relief that is available. So in Ayurveda, we comprehensively understand this condition as a condition which can be triggered with certain kind of foods, certain kind of activities, certain kind of lifestyles. All these things are holistically analyzed, and only after that the treatment will be planned. So in Ayurveda, there are different kinds of treatments, and especially in skin disorders, there is Antar Parimarjana and Bahir Parimarjana. So Antar Parimarjana is something like internal cleansing, and Bahir Parimarjana is something that we do externally. So these two concepts become very important in the management of all skin disorders, and especially allergic or atopic dermatitis. Atopic dermatitis presents with various forms of manifestation. Basically, it is an erythematous or a reddish discoloration of the skin, which is inflamed and with very itchy and sometimes burning sensation, and in a few cases there can be oozing also. So Ayurveda understands these conditions based on the doshas. So up to what level these doshas are involved, like Vata, Pitta or Kapha, or a combination of two or a combination of three, and how it has affected different tissues in the body, especially the skin. So what is the depth of the involvement of the doshas in the skin, and how to eliminate them. So elimination of these doshas or the toxins out of the body, so which might be one of the important causative factors of this condition, is very, very important. So what we do in Ayurveda is, like depending upon the chronicity of the condition, we either choose internal cleansing or we just choose like external application and some medications. But in most of the conditions, when it becomes chronic, so internal cleansing or Antar Parimarjana is very, very important. So this is done after a thorough analysis of the patient, and then we suggest certain kind of preparatory treatments, which is also called as Purva Karmas. So wherein the patient is given certain kind of medicines for a period of time, like 3 to 5 days. We give internally, we give a medicine which is called as Snehapana, which is usually in a form of ghee, which is given in increasing dosages for 3 to 5 days, and then it will be also associated with other external treatments like Abhyangam, and either we choose to do Vamana, which is a emesis therapy, or we choose to do a Virechana therapy, which eliminates the doshas. In some cases we choose to do both, like Vamana is also done and Virechana is also done. Once this first step of cleansing happens, so there are other sets of treatments wherein we go ahead with Takradhara or Kashayadhara or Lepas, which will be helpful in soothing the irritated skin and also to improve the resistance of the skin towards certain allergens. So this modality of treatment, which might range from either 7 days, 14 days or 21 days, is done as an in-house treatment. And for very a small number of cases wherein like it's not very severe and the chronicity is less, so maybe some internal medications and external applications in the form of oils or in the form of lotions or in the form of fresh herbs will be done. So Ayurveda, through its holistic approach, not only just about the medical treatments such as Panchakarma, but also through diet and lifestyle modifications. So we identify what is the causative factor, what are the foods that might trigger the condition. And this understanding is based on understanding of the person in terms of the constitution. So whether the person is of Vata constitution, Pitta constitution or Kapha constitution, this is understood, and based on that we eliminate certain kind of diet and advise certain kind of diet which has to be taken, number one. And number two is with the lifestyle. So lifestyle becomes very, very important, stress being one of the very important triggering factors in all skin disorders and especially in allergic and atopic dermatitis. So we always advise, along with the medicines, the treatment, we advise a proper diet, we advise proper kind of yoga and other mechanisms through which one can reduce the stress. And also when we talk about the whole person care, we also talk about other morbid conditions which the patient might have, and that is also taken care of while treating skin disorders.